So welcome everybody. Thank you very much for making it live if you are able to. We are continuing with our sessions, and today we are focusing on the P in TAP CV, which is pictures and multimodal communication. So we are going to, let's just dig in. We have quite a lot to cover as usual. Just quickly over the agenda, we will go through our learning goals, do a very quick TAP CV refresher, and then we'll do an overview of what is meant by multimodal communication. We'll touch it very lightly because we want to focus today on pictures, right? And then we will do what I call the meat of the session today. And I'm really excited to share this because you probably have an innate feeling that pictures are good, but it's good to have the research evidence that you can have for yourself and share with others on the impact of pictures. And then we'll do the practical tips for actually using pictures once we know that they're important, using them, and then doing some key takeaways. So that's the plan. Please do feel free, as always, come off mute and share thoughts and comments. We're trying to recreate sitting in a cold conference room somewhere today, okay? So what are our goals for today? We want to understand multimodal communication at a really high level, but the focus is recognizing the research findings that are telling us how pictures improve understanding, recall, and behavior change, right? And then we're going to learn practical tips for choosing and using pictures in health materials. This is just a peek to next week, the workshop. As always, the training is a little bit less interactive, it's heavy on materials, but I want you to be excited about the workshop. Next week, we're going to actually test for ourselves the impact on pictures on our own memories. And then I'm going to go through some practical sources for getting pictures. Some of them are free, some of them free with a little bit of like burden of coming in and such. And then also using AI tools to generate your own image that you want for your own specific use cases, right? And then we'll do an exercise on turning text-heavy message into something with pictures. So that is for next week. This week, we are going to go through the research and then learn the practical tips. Sounds like a plan? All right. Silence means consent here. So as usual, let's do a very quick refresher. I always want to remind you where TAP CV is coming from. TAP CV is just a mnemonic to remember the guidance from the AHRQ Universal Health Literacy Precautions Toolkit. We've already done our teach back and our language deep dives. Now we're doing P. P is for pictures and multimodal communication in our TAP CV, right? And we are going to dig more deeply into this, so I won't read out this description, but you have the deck and you can look at it. People learn in different ways, and most of us, it turns out, also like pictures. So let's go into this first section. What is multimodal communication? I want to share with you just an
No,
overview.
I just decided not to go in.
Oops, sorry, Adlern, we have you on.
Uh,
Let me see. Okay, good. I was just able to mute Adlern. So an overview of the different modes of communication, right? We written and verbal is clear enough. Today, we're going to focus on using pictures and visuals. But I wanted to share with you also some ways that you may not often think of, but that are critical in improving health literacy. Body language. I'm sure
Yeah.
the clinicians amongst you know know how important it is. Tone of voice, eye contact, even how you are shaped when you're speaking to somebody. It all adds to the message. And then also non-spoken sounds. So for instance, in my tribe, we use a lot of sounds. Like when you're talking to someone and they go like, you know that they agree. If they go, you know that they are not agreeing with you. So these various sounds, like even like all of that is part of the language that and all the communication that you may be doing without being quite aware of it. And then there's also using your body to demonstrate what you are saying. This icon here was very funny. I don't actually believe that anybody, well, maybe some people can do these three things, but I just wanted to show the sense of doing things with your body. So if you're explaining to someone how to use an inhaler or do something, you're actually showing them with your body. All these cues help people to remember. So, as I said, we have an hour. We can't go through all of these. Today, where we are going to focus is pictures, using pictures and visuals to enhance the communication. So, first off, I'll be interested, is any of these modes a surprise, or this is something that you are aware of too? I know in some parts of the world it's you don't have many non-spoken sounds, but where I'm from in West Africa, we do have a lot of non-spoken sounds. People can make different sounds that and everybody kind of knows what it means, right?
Oh,
Okay, go ahead, Lucinda.
like for us would be oh,
Oh, okay.
or using our eyes.
The body language. What does the O mean?
Yeah, or I agree.
I agree.
Uh-huh. Or
hmm
yeah.
Yeah.
Oh,
And go ahead, Gary.
just let us
Oh,
not very
he said, oh, he agreed. Okay, I get it. I get it. And some of the more there are some clicks that I actually can do, but if you're talking to someone in from where in my tribe and they go like, they are saying that they agree, right? And if you hear that, that's not a good sign. So paying attention to all of those. All right. So but today we're doing pictures. Maybe another time there could be more on the modes. So think of this part, right? I know we want to learn actually how to be effective in using pictures. But I wanted to share with you some stories about why pictures are important so that as you are going through your daily work, if you are having to take the extra step to include pictures and visuals, you understand the value. Okay. I have there's a lot of research there, but I particularly like the paper that I've cited down here. It's called The Role of Pictures in Improving Health Communication. It's great because it's on its own is summarizing a lot of the research. So I know this is not a discussion about research detail, but if you want to go and look at more, that paper is a great paper. But I've pulled out the main insights in a succinct way that we can talk about. Believe believe me, and then also go check the paper. But in 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 many research studies, they found evidence that pictures do are a very powerful tool, and they do these four things on the page. And we'll talk about each and share a story about each so that you have that to share with others. The first is that pictures attract attention. We'll talk about the research evidence, but they grab people's eyes so that they focus on the information. There's a lot of information that we don't even pay attention to or consume. If you have pictures in there, you are more likely to get people to look at them. The second is that pictures actually increase comprehension. And this is particularly true for people with low literacy. We discussed probably two sessions ago how 54% of US adults are able to read at less than fifth grade. So this is actually very important, right? If you are ever putting in images, hello Anna, and you are like, oh my God, this is so much work. Remember that it's actually very important for much of the population, right? And then the other thing is that pictures improve recall. When you show pictures alongside spoken or written words, It actually helps people remember more. And this is an exercise that we'll do for ourselves next week to test it out. And then finally, pictures improve patients' behavior. So I shouldn't say improve, it increases their adherence to the behavior you want them to do. We are assuming what we're asking them to do is helpful for them, right? So patients are more likely to follow the advice. So capture these four things in your mind for whenever you are putting in pictures or doing that extra step to add pictures to your text. Remember that is important, right? So let me go through each of these now with a little story, a little bit more of the research evidence so that you may remember. This page and the following pages, they are all very heavy. I'm hoping that you keep this deck as a sort of a reference for you, right? But I wanted to share some concrete research evidence so that if anyone ever asks you why you are suggesting using pictures, you can actually point to some research evidence. You don't need to remember the numbers per se. But for the point around pictures capturing attention, the problem is that people ignore health information and guidance that can benefit them. And this is simply true. It may it may seem counterintuitive when you are providing information that you know will be helpful, and the person also, if they would only consume it, would find it helpful. But you need to get their attention first. Now, this is where the research evidence is very encouraging about pictures. Having pictures in whatever you are sharing, verbally or through text, increases the likelihood that the patients, the family, the community members will look at and consume the information. So this little pictograph diagram I'm making here is a summary of one of the research findings from the paper down here. And here's the story. 234 patients leaving an emergency department. You don't have to remember the 234. I put that number there to show you that it was quite a large number of patients, right? But these people had serious lacerations, enough to come to the ED. Randomly, half of them, upon discharge, were given wound care instructions. Half got the same instructions, text only. The other half got the same instructions, but with text and pictures. And then 3 days later, they were called by phone to see whether they had read the instructions, right? Now, these people had been badly hurt enough to come to the ED. So checking to see if they've even read what to do after they've left the ED, you would think that, of course, everyone would have done it. Those who had the instructions by text only, of them, about 80% had read it. But those who had the same text but with pictures, almost 100% had read it. This is, again, let's round it up, almost 20% higher engagement, right? This is just getting people to look at it and then maybe even decide for themselves if they think they'll follow it or not. A lot of times you can't even get people to engage with the material. So putting pictures in is critical if you are trying to capture attention, right? Is the first step to get people to engage with material. And then the other thing is that people just like pictures. If you are looking at like huge chunks of text, it's just hard on the eye, a little boring. People like pictures. So that's one reason to put in pictures. So remember, putting pictures, doing the actual work to put pictures, it helps capture attention, right? Does this story sit well with you? No surprises there?
No,
Yes, go ahead, Gary.
I would say no surprises. Imagery is very powerful.
Yeah, yeah. And this is something we all feel. It's good to have research that has been done. This was statistically significant, this change that you can point to anybody who's like not quite there. All right, so this is the second part of pictures increasing comprehension. This is actually very important because you can look at something and not understand it, not do anything with it, right? Right. Yes. Visual learners. Thank you, Lucinda. So here is a very important piece of information that comes from the literature and the research that combining words and pictures, even if it's easy to read words, combining that with pictures is helpful, especially to people with low literacy, right? So let me tell you a story again from the research. This one was about sharing cervical cancer prevention information. Again, I put the number here just so you see it was a good size number, 217 women. Again, randomly, half of them got the same pamphlet, but with text only. The other half got the pamphlet, but with text and pictures. Across the full group, those who read the text only were able to answer, no, sorry, let me say it again. A high score on the comprehension test were being able to answer 7 out of 8 questions right. So across the full group, 53% who got the text only got 7 or more questions right. This is the measure of comprehension. But if they got the text and pictures, you had 65%. You can see that this is higher, and these numbers were statistically significant. So across the full group of women, having pictures in the pamphlet increased the comprehension. Now, what is comprehension as measured by being able to answer those questions? But what is particularly interesting is that they found that women who had low literacy, amongst that group, it was even more of a jump in comprehension by having the pictures. So within that women with low literacy group, 35% got high scores with text only. But when you put the pictures along with that same text, then the comprehension score jumped, right? So the message, and this is found in various studies, the message was that the pamphlets having illustrations increases and statistically significantly comprehension. And that is especially true for people who have low literacy, right?
In regard to
Emily, are you speaking? Sorry,
My
Emily, we
bad.
can't hear you.
Sorry.
Oh, no worries. Okay. So, but this finding had some new ones. Let me just point out the main findings, just so you remember. I think it's absolutely right for you to come away saying that combining words and pictures is especially helpful to people with low literacy, right? The the research also showed that, I hope you can see my mouse, the pictures that I use must be uncomplicated and related to the words or that are spoken or written. You can't just, it's not just any pictures, right? If you're doing health, a pamphlet and you just put in, I don't know, pictures of rainbows or something, it's not necessarily going to increase the comprehension. They had to be related. And then the other thing was that the pictures had to be culturally relevant. This same study found that some women who had issues with what they thought was shameful or taboo pictures, they didn't respond well to including pictures in the pamphlet, right? So there's more here, there's some more nuance here. The thing is that the pictures help people remember, but some people were put off by, they didn't want to see a picture of a cervix, for instance, and that made them tune out. So we will talk about this some more, but it's also important that the pictures that are being used are sensitive and culturally relevant. But overall, coming away with the conclusion that pictures and words helps increase comprehension is, there's a lot of evidence supporting that, right? Any thoughts on or comments on this before we move on? Okay. So here's another story that you can share, that especially for low literacy people, adding in the pictures, even adding in pictures to easy to read language is significantly important. Now on recall, let's talk about recall. You can engage with the material when it's provided to you because there are pictures. You can understand it, but if you don't recall it, you may not be able to use it in the moment where it matters. So this is where the fact that patients forget much of the health information that's passed on to them is just unfortunate. But it's also where the power of pictures comes in. The research evidence is showing that pictures actually help increase recall. So the evidence, that's the story of the research that I'm sharing with you. This one was around cancer patients in Baltimore. This was in Johns Hopkins. All of these patients had less than fifth grade or less reading level. They were given information about their conditions and treatments verbally and with pictures at the time that they were being taught. So you can imagine, actually, you can imagine that there are pictures and you're pointing to them as the provider is talking to them. And this is remarkable that after a month, when they were tested on the information, the average score was out of 200 questions. It's not like they were asked 10 questions. They were asked 200 questions, almost 200 questions. The average score was 72%. So let's compare this to even immediate recall, right? And I put this here as a finding just because it's so stark. These 21 people, when they were given the instructions verbally only without pictures, immediate recall was only 14% of them could remember much of, sorry, the average score was only 14% out on the questions they were asked. Whereas those who were given the information along with pictures, you can think of the pictures as cueing your mind to remember, they got a score of 85%, right? But even after a month where lots of things have happened, you still have them getting a score of 72%. So this is actually really powerful to remind you how important pictures are in helping people recall. Because most of the health decisions that people need to make, it's in the moment. They may not even remember where they got the information to go and recheck it. So it's very powerful that they recall. Okay. Is anyone, is any of this like surprise? I should say I was really surprised by the gap, the huge difference that having pictures along with the verbal or spoken word or written word did with recall. Okay. Yeah. Thank you, Dr. Paula. Right. So the I think the other thing to note, let me go through these main findings in some order here. It's the combination of pictures with text, verbal or written text, that drives the highest recall. You need the words and the picture to drive the highest recall, right? And then I think also very importantly, people with low literacy benefit the most from using that combination of text. And everyone is good for everyone, but it's especially important for people with low literacy. So when we think about it, using pictures is a key tool to reduce disparities in recall, right? And this is really about getting people to have access to the information that they need in the moments that they need them. Okay. All right, let's just do a time check here. Okay, all right, we're good on time. Now let's talk about I say conclusion, which I'm saying accept based on the research there and other research here. And this is the most important. There's evidence that having pictures in the material actually increases people's adherence. When you think about it, for people to change their behavior, they need to remember. They need to remember what it is that they need to change. They need to understand and they need to trust the information, right? So part of the challenge with adherence is that people don't remember, understand, nor trust the information. And what the research is showing that pictures actually increase the likelihood that patients, when one, they will look at it and then they intend to act and then actually do act on it. So going back to that same study around the patients with lacerations in the ED, those who got the text-only instructions for how to care for their wounds, when they checked in 3 days later, 54% of them had been adhering to the instructions. Those who got that same text, but with pictures, adherence had jumped to 77%. This is like a huge jump just by including relevant pictures, right? This is one study. This is not saying that there'll always be this jump. Or you remember the point I made that the choice of pictures also matters, right? You could actually put people off by putting in images that makes them recoil. But assuming that you're putting in relevant images along with the text and labeling and captions, you could see such a huge jump in adherence to something as important as wound care, right? So here are some findings. Again, to remind you as you're doing your work, why you should go through the extra steps to put in pictures. Patients are more likely to adhere to the guidance if it's accompanied by the illustrations. And importantly, it improves recall because sometimes people do intend to do something, but in the moment they've forgotten what it is that they need to do. So let me just come back to the summary page here. Now we have stories against all of these. And I say stories as in research evidence that hopefully you can quickly share with yourself and with others when you are in a position to include pictures or not, right? Any thoughts or comments? Were any of these the stark difference, I would say, between having pictures and not having pictures? For me, that was a really huge insight, how big the difference was. We all say things like a picture is worth 1,000 words and such. We all sort of innately believe that pictures are important. But to look at research evidence to see just how much difference that the pictures can make was stark to me. Okay. All right. Yes, Latonia.
We're just gonna say that it speaks true to what we did when we were in Washington, when we were doing our media campaign. I mean, all of the posters that we created had pictures on there, and they were really grasping everybody who was displaying what campaign that they had.
Right. Yeah. I think we like pictures, and the research evidence that it makes such a huge difference, I hope gives you the extra push to include pictures in your work. So now we know the why. Let's talk about the how to do it. So we're going to talk through some practical tips for using pictures effectively in all sorts of health communication. And as usual, I have a picture to aid in us remembering, right? So think of the steps that we're going to share here. When I was thinking of an image, I wanted something that had 2 things in the foreground and 3 things in the background. You don't necessarily need to remember it the same way, but I think of this image as 2 boulders and 3 hills in the background because I wanted a landscape. This is something that I'm super excited to teach you next week because I generated this image with AI. I described what I wanted and it built it. It's a very powerful thing to be able to get the image just the way you want it. Of course, I'm also going to share with you many free and some paid image sources, but I'd really encourage you to play around with generating your own images, right? So I want you to get from this that there's some core tips. There's a lot more, but some core tips for using images to enhance health message. The first thing in the foreground, which is the boulder, is think visually. Always look for ways to use pictures to support your message. Whatever message it is, there's probably some way in which you can use pictures to enhance it. So that's the first practice that you should think of, right? And it's it may seem like we are so used to seeing many things which are just blocks of text, but we should remember also that we actually know better. For instance, we know that the even the text should be at sixth grade level or below, but much of the text it's as 10th grade or college level. So it's okay to be different here because being different is being better per the evidence, right? So whatever it is that you are creating, no matter how like serious it is, think of how you can use pictures to support it. Now, on the next thing is like you need to keep it simple. And you may be surprised, but this was something that I was fortunate to learn many years ago to use simple images. So you'll see that in all the material that I've shared with you, there's a lot of black and whites, there's a lot of cartoon. That's actually purposeful. You use the simplest image that makes the point. We won't go into that, but there's also evidence that using complicated images distracts many people and also even worse for people with low literacy. It's not clear what the mechanism is to me. We will need to take that evidence. But the best practice is to use the simplest image that makes the point. Okay. And then we already hinted at this. Use the combination of images and words. That's powerful. So always support the images with text or spoken words. It's not enough to have just the images, even if they are relevant, because in misinterpretation, actually, I shouldn't say misinterpretation, we're all different. We interpret things very differently, right? So I think these look like boulders and these look like hills. Maybe they look like things, different things to someone else. So I needed to say what the image is with words as well as pointing to the image. Mhm. The fourth core tip, think of it as the third hill in the background here, is that you need to reflect the culture. You use images that reflect familiar scenes, familiar clothes, familiar foods. And we will talk about this shortly. But again, there's research evidence to show that images that reflect the culture are what are effective. Images that don't either don't improve recall or engagement, or in some cases, they make it worse because people recoil from the message entirely. And that's not what you want at all, okay? So for this framework, for me, the fifth core tip, and the other thing that you should think in the foreground of all the pictures you're using is that they need to be co-created and tested. Involve the audience that you are serving in identifying the image that gives the message, right? So I don't, was it Teresa? I worked with one, or maybe it was Lucinda. Lucinda, did we work on your poster that you had for the
Yes.
pharmacy? Yes, it was Lucinda. So for instance, Lucinda is lucky to be both in the mindset of the creator as well as the audience. She understands the audience. So for her, co-creating and testing could all be done in her, right? But sometimes if you are speaking to a group that you are not sure you understand well, you absolutely need to test the image with them because it's not just about how things look, it's about unwitting messages that you may be given, right? So just a story here. My very close girlfriend is Indian, and at her wedding, she wore red. In my tribe, red is a sign of anger and a sign of war and a sign of mourning. The idea that you will wear red to a wedding is like a huge no-no, right? So something like that, well, I happen to know because I know her, but the same message may be interpreted very, very differently. Okay. So has this, I'm trying to keep this up on the page a little bit longer to get it to sink in. This is how I remember it. There are two things in the foreground that you should absolutely do. Think visually and co-create and test. At worst, you have to do that, right? And then these three hills in the background, remember, keep it simple, words and images, and reflect the culture. Okay. Now, let's take each of these core principles and say a little bit more about them. I did mention this before. Any health message can be enhanced with pictures, anything. The work you need to do is you need to ask, what are the most important points I want people to remember from whatever it is you're sharing? And then do some work to think of concrete visuals that show the point or make the points with images, right? So this image on the right here is taken from the paper that I've been referencing throughout. They took it from another paper. So you see the citation here. It's used with permission from this paper. But this image here is to remind people how to take their pills. I mean, it will almost be hard to not know that they want you to take 2 pills at 8 a.m., 2 pills at noon, 2 pills at 4, 2 pills at 8 p.m. This is putting the information in a way that is hard to misconstrue. And even better, there's also the information with the words. Take 2 pills each time. They've drawn the key, what a tablet is, half tablet. Time to take the medicine, right? Do you see the image? If you can give me thumbs up or say yes or something. The sound changed a little bit. I want to make sure you can hear me. Can everybody hear me still? Okay, great.
Yep.
Thank you, Anna. Right. So someone did the work here to think through how to put this dosage instructions in an image, right? Now imagine that, combine this along with you explaining to them and them, the person having this picture. It's hard. It's not impossible, but it really helps you know when you are supposed to do something. Okay, so think visually. That's the first. Now let's go to this aspect of keeping it simple. Remember, simple is best to avoid misunderstandings. So using simple, realistic drawings that deliver one message at a time, right? So the idea is that each image should have one main idea, avoid extra details. And wherever possible, use simple line drawings over photographs, because again, we're talking about all of that detail that may be distracting. If you're going to use colors, simple colors, colors with high contrast, right? If you're going to use colors at all. So let's look at this example here. This tells you what the image is about. Wash your hands. These look like human hands. They are under a tap. There's water coming there. You can imagine this little bubbles, this wash your hands. Whereas this other one, I mean, you could make so many stories of this, right? Tidy your bathroom, have like a nice, somebody loves the beach. When you look at this picture, it's unclear what the message is, right? So this one is doing a couple things, right? One simple message, simple line drawings, then text with the picture, okay? This one has too much room to be misconstrued, all right?
And be using
Yes.
appropriate pictures too, because on that photo there, you see him in the mirror and he's got a frown on his face. So
Yes. He has been confused by the picture, right? And like he seems to have carpet in his bathroom, which is a weird choice, but well, weird to me. But yeah, this is just too much. It's so distracting. I look at it and I'm like, why does he have 2 soap dispensers? It looks like there's a soap dispenser up there. Actually, he has 3. There's way too much going on in this image. So you get the idea. Simple, right? Simple. All right. Now the next guide is integrate words and the images. So this is sounding very prescriptive, but I'm translating what the research has said, and I'm trying to get it to be succinct messages that you remember. But just always think it's images plus words. It's not enough to have, we know just words is problematic, but it's also not enough to have just images. You need clear captions or spoken words to explain the image, right? And you need the text to be simple, close to the image. If you are physically speaking, you point to the image that you're talking about, right? So let's talk about, let me do the one that's working before we talk about the one that's problematic. This image says, take one pill every morning at 8 a.m. Well, actually, it's very confusing. The clock is pointing to 4. So this one is also problematic. A better image would have been to point to 8 a.m., right? This is something that I generated with AI. So I didn't notice it, in honesty. I should have gone and said, make the clock point to 8 a.m. That would have been better. But it still has some good things going for it. There's the pill bottle, and there's one pill, and there's a clock, and then it's saying, it's giving you the message, right? So assume that we had fixed this thing. The image is clear, easy to interpret. Let's look at this other one. It does have one pill. It has the clock pointing to 8, and it has a random dot on what appears to be a calendar. So this will be a case of very, very easy to misinterpret without captions, without spoken words, right? Especially if the pill that the person is supposed to take doesn't look like the capsule, then they'll be even more confused. Okay. So the thing to remember is that pictures are most powerful when you are supporting their interpretation with words and guiding how you need them or want them to be interpreted. Because we can all look at the same thing and come up with very different messages, right? I wonder, maybe we should have done this test. I should not have shown this and asked you what you thought this meant. Okay. Okay. So let's go to the fourth core point now. It's not enough just to throw any image in there. We've agreed on that. But even if the image is related, the image needs to be culturally sensitive and familiar. You want to use images that are culturally acceptable, because some images can be upsetting, feel shameful, or feel like taboo to talk about. And the the message will be totally lost because people have recoiled and are just not listening to you at that point. Okay. So in this example here, I wanted to show how you can share a message about asking people or encouraging them to check their blood pressure. So here's one where it says, love your heart, their hearts on the cuff, and the message is clear, check your blood pressure. It seems innocuous, it's telling you to do something. But here's another one that's showing a cemetery. This is true. It's true that unchecked high blood pressure increases your risk of death, but this is not at all a sensitive way of sharing that information. And in fact, it's not actually even telling people exactly what to do. It's not saying go check your high blood. It's upsetting, right? So you have to be careful that this is where the testing comes in, right? But you have to be careful. You need to use familiar objects, settings, and you need to test the pictures for the meaning, not just their appearance. You are checking the gestures, symbols, and colors, for instance, right? I told you the idea of red at a wedding would be very, very offensive to people from my tribe, but my friends who's Indian, everybody's wearing red at a wedding. Okay. All right. So that's the fourth point here. And then this fifth point, which is in the foreground, this boulder is also as important as beginning to think visually at all. Co-create and test. Involve the audience in identifying the images. You involve the community members from the start. You test drafts, test for meaning and appearance, check for emotional or cultural sensitivity, and you keep improving the pictures based on the feedback, right? These pictures here, this came from the paper again that I've been referring to. They used it with permission from another paper. But the setting was they were building images to use in guiding medication, when people should take medication in a low literate population that happened to be in South Africa, right? Look at the images and it doesn't seem very different, but the research found that there was a significant difference when they used the locally tested image versus the image that came up before testing. So let me point out some things to you that it seems minute, but made a difference. In here, there's just somebody putting something in their mouth. Who knows what that could be? It could be Skittles. It could be food. This picture could just be saying eat well, right? The other thing is that the plate here has a fork, a knife, and a spoon. After they had tested with people in the local place, this is what they came up with. They drew a clock to say that this was noon. But importantly, they drew a little pill bottle here to say that the thing that is going in the mouth is the pill. We're not asking you to put random things in your mouth. And then look at the food. The food is very different. People tend to use just one utensil, and the plate is shown from the side because, again, I didn't realize this because I grew up like that. I can tell you, growing up in Ghana, whenever you see a picture of a restaurant and food, it's a side view. And it's when I looked at this that I realized that, oh my God, there's actually a tiny difference there, that we are used to looking at food from a side view. So this says that it is food. The plate is here. This could be a table mat. And especially if people are not aware that this is a fork, knife, and spoon, it won't work. So this is all saying that it is hugely important to test the picture with the intended audience, because some things that one may take for granted is clear may not at all be clear to the audience, okay? This looks like a plate with fork and knife, but if someone is not thinking of fork and knife, these just look very odd or saying something that is not intended. So this paper, and again, you can look at it if you want more detail, they found that using images that were culturally sensitive, co-created, is what made the difference, right? So let me go back to the starting frame, and let's remember what we've talked about. We are thinking visually. Anything that you're doing probably can be improved in terms of recall, comprehension, getting attention, by having pictures. Keep things simple. Counterintuitively, the more detailed the picture is, the less detail people will get from it because it's too distracting. It's always images and words. Neither on its own is as effective. And you need to reflect the culture. And one of the most important ways of doing that is co-creating and testing. Okay. All right. So these are the practical tips. I want to just round out with the key points again. Again, I hope you will recall the boulders and the mountains, and also those four main learnings from the research that you should remember. But the key takeaway, pictures are important. They're not just pretty. They boost attention, recall, comprehension, adherence, and especially so for people with low literacy, right? So this is a way to addressing some of the health disparities by using pictures. And pictures are best in combination with words, whether written or spoken. You need to have captions, you need to have labeling so that the pictures are not misinterpreted, right? Keep it simple. Keeping pictures simple without extra details focused on one message. That is what works. And the pictures need to be related. We're not putting in pictures there merely to capture attention. They need to be related to the message. And then finally, you want to make sure that you have an awareness of your audience. You've either co-created with them or you've tested with them so that you've refined it so that the intended meaning is what is there. On this point about co-creating and testing, it suggests that it's not enough to just say to, let's say, an artist, turn this message into pictures for me. It needs to be with someone who understands the audience and also the message that you want out there. Okay, so that's what I want to share today. Let's talk a little bit about any comments or thoughts that you've gathered from our time today. Let me go back to the framework here. Are these things that you see in your line of work you can incorporate? Are there some things that you're not yet quite sold on? Any comment? And I'm about to call on you, Gary, because you are always a life party. Did we lose Gary?
No, I'm right here.
Oh, you're
I'm
right
here.
here. Okay, sorry, I couldn't see you in the list. Yeah.
No, I think we've been doing this for a while now, and so the cool stuff that comes out of Hopi, it's been all there's a lot of symbology, and so the directions, particularly if it's kind of pointing to a direction or like the time, it's also relevant with color. So the story you shared about your friends wearing red, it's also symbolic too. So yeah, just not necessarily just the imagery, but the colors also.
Mm-hmm. Thank you for that. Any other thoughts? Okay. Well, then we have 4 minutes left. Sorry, did someone just get off mute?
Yeah, that was me. This is Lucinda.
Oh, yes, please go ahead, Lucinda.
Um, I just want to say that using imagery is a great way to share information with our patients. An example, we're working with, or our topic is families first, and our focus is on pregnancy. A lot of our women who come to our prenatal clinics don't know the symptoms of pregnancy. So we've created flashcards, and on the flashcards, we're using some of the designs from the Ojibways, as well as pictures, basically the words of the symptoms. And there's another set of flashcards about birthing timeline. So that incorporates different pictures. So that's what we're doing in Bemidji area. Using imagery and simple words is really important.
Thank you for sharing that, Lucinda. And I think next week I'm really excited to show you first of all, the pictures, the sources of pictures, right? Like iStock photo and all of those things. But especially for something where you want to show a certain tribe's own imagery, if you are generating your image, you can put in an example and say, generate an image in the style of this. That's very powerful, right? I think I remember when we met, someone had shared that you don't use AI to generate text and such, but I'm hoping that when it comes to an image, it may be a different thing. I use it all the time. As I said, I generated this, but we will go through both sources that are already existing and a few tips for if you want to create your images and your own image. It's incredibly easy. I would appreciate very much if you take, we have 3 minutes left and there's 3 questions. If you would take time to scan the QR code and answer these questions. And then I'm also going to put the link in the chat for us.